Well, hello there, future nurses. Welcome back to another episode of Med Monday. Let's go ahead and jump right in. Our featured medication this week is levofloxacin, otherwise known as Levaquin, which is the trade name. The functional class is anti-infective, and the chemical class is fluoroquinolone. This medication can be given in a liquid solution orally or in a tablet, and it can also be given IV. It's a broad-spectrum antibiotic, and it's used for gram-negative and gram-positive bacteria. And it works by inhibiting the bacterial cell division. Pretty cool. So why do we give this? We give it for acute sinusitis, acute and chronic bronchitis, CAP or community-acquired pneumonia, UTIs, urinary tract infections, and cellulitis. Contraindications, or why we don't give this medication, include hypersensitivity. Now, we can give this medication with certain conditions, but we want to do it cautiously. So there are precautions, and that includes pregnancy and breastfeeding, patients with atrial fibrillation, patients who are diabetic because it can cause hypoglycemia, patients with prolonged QT segments, patients who have myasthenia gravis, patients who have hepatic and renal disease, and patients with seizures disorders. Now, side effects, which are non-life-threatening, include headache, dizziness, insomnia, and anxiety, chest pain, palpitations, and hypotension if it's infused too quickly, dry mouth and tinnitus. As always, nausea, vomiting, diarrhea, and abdominal pain, vaginitis, rash and photosensitivity, hypoglycemia in our diabetic patients, and pneumonitis. Our adverse reactions, or reactions that can be potentially life-threatening, include seizures, prolonged QT segment, pseudomembranous colitis, hepatotoxicity, pancreatitis, hemolytic anemia, epidermal necrolysis, tendon rupture, rhabdomyolysis, anaphylaxis, angioedema, and our favorite Stevens-Johnson syndrome. So, nursing considerations. This medication does have a black box warning. So, we need to be aware of and monitor our patients for tendon pain or rupture. The most common tendon affected is the Achilles tendon, tendinitis, and myasthenia gravis. Myasthenia gravis is a weakness and rapid fatigue of muscles, and it's caused by a breakdown of communication between the nerves and the muscles. The worst case scenario is that this affects your diaphragm, which will affect your breathing, but it can affect any muscle in your body. So we need to be aware of that and watch out for our patients. This has no cure. So I did see something about multiple lawsuits regarding this, but it is a medication that works for a lot of things. And so it's just something we need to be monitoring our patients for. Now, other considerations, if our patients have a history of allergies, we want to make sure that it's not to this medication. We want to monitor our white blood cell count to make sure that it is actually working and lowering those white blood cells. We want to make sure our patients increase their fluid intake if they're able to. They don't have a condition which contraindicates that. We want to assess for a therapeutic response. So is this working? We want to monitor our renal and hepatic function, especially in our geriatric patients. So what are we going to teach our patient? Well, we want to make sure that they do not take this medication 2 hours before or after taking antacids, iron, calcium, or zinc. We want to make sure that they finish the full course of the medication, that our diabetic patients know that they need to be monitoring their blood sugar, that it can cause photosensitivity. We also want to teach them the signs and symptoms of an allergic reaction compared to side effects. We want them to know signs and symptoms of tendon rupture, myasthenia gravis, or neurotoxicity, especially in our patients who have neuropathy. It can affect them a little bit more. And we want them to report any itching, rash, foul-smelling stool, or vaginal itching, which can indicate superinfection. And we, as always, want them to check with their physician or pharmacist before taking any other over-the-counter or herbal medications and supplements. So that's it. Now we're at our weekly challenge question. Answer this question correctly on Facebook, and you will be entered into a drawing to win a $25 Amazon gift card. You are to administer levofloxacin to your patient. The pharmacy sends you a single-use vial, 750 milligrams in 30 mLs, that needs to be diluted in 150 mLs NS. What will the concentration of the diluted solution be? Go ahead and leave your answer in the comment section on Facebook. And if you haven't subscribed to Med Monday, you can go to Nursing School Simplified /Med Monday. I'll send you the videos every week, and I will send you a medication fact sheet to go along with that, so you can use it as a resource to study or for your drug cards for your clinical. So I hope you guys have a great week. And as always, keep working on your dream.